you can hide your feet. You can wear big boots, you can wear a long dress, you can sit down. You can't really hide your hands. They're part of your identity.
It's amazing once you lose function in a hand, how that impacts just being able to brush your teeth or comb your hair or dress yourself.
I can remember the first time that I had met a patient with a hand injury. She was a seamstress, and in both her hands, she had knuckle replacements on both hands. And I just remember seeing that and just having such an impact on me, and I couldn't have imagined how it would have impacted her.
If you really want to change somebody's life, then you fix their hand.
I was driving in Anchorage. I came to a red light and stopped. All of a sudden there was a banging on my window, and it was my former patient. He was out protesting something, but he's standing there in the middle of Northern Lights Boulevard going, "Hey Mac, look, 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 look." And of course, my passenger was just wondering what had happened. But it was just really neat to have him recognize me and show me what he could do on that. So there are days like that you get your gold star, and there are some days you go home wondering if you chose the right field. But bit by bit, you get to see people more able to be themselves. And hand therapy is a key ingredient in that.
Up and down. Good. Just stretch it out a little bit in between each one.
I started out in physical therapy working with burn patients and quickly learned that the injuries to the hand were the most devastating and the most difficult to rehabilitate.
I can't drive, I'm limited. I can't really cook properly at home, so it's really been difficult.
I feel very, very strong about my academic training, and I feel that you cannot treat the hand without treating the shoulder or without treating the spine.
Physical therapists are the field that learn how to treat the body as a whole and use all of its systems to integrate that care.
If we look at her soft tissue on her ring finger, what area...
We have a strong foundational science in anatomy, kinesiology, motor control, motor learning, and these are all important aspects.
Physical therapists that work with hand therapy, they might be in acute care and work with patients who have burn injuries. They could work with the neurological population with someone who has a stroke. They work in orthopedics. There's pediatric hand therapists that are working with children. So we truly cross many, many, many areas of physical therapy.
Keep using that left hand all the way throughout.
I think as a hand therapist, we're teachers, coaches, we reassess and reevaluate and we change the plan of care, but, we have to motivate them to want to do the work. And the nice thing about hand patients is they see the benefit right away, so they want to work too.
So what's your opinion?
For his post-op splint.
The relationship of the hand therapist to a physician is an extremely close relationship. The cases are approached as a team together, working to try to solve the issues. And I'm constantly problem solving, and I'm constantly trying to come up with a new creative way to help somebody move in the manner in which they need to move in order to get better.
Backhand, get ready. Oh, but much better. You were moving the arm much better.
Many times we also end up splinting patients, and the whole field of orthotics and trying to design the correct orthotic for the patient is very creative. No two surgeries are alike, no two patients are alike, and we have to be able to think on our feet, establish new patterns, and create new orthotics that are going to meet the needs of the patient.
Touch your thumb and your index finger. Does that bother you at all in this web space?
EPTA's hand section provides a lot of opportunities. I'm not a certified hand therapist, but I know that my patients need a lot of expertise and need to be very up to date. And I have two avenues through the hand section that help me. One is the newsletter. It gives me an insight into what the current topics in hand therapy are. And two, is the insight and wisdom of my colleagues.
Physical therapists do get some coverage of the hand in their training. However, it's not quite as in-depth as they may need for some diagnoses.
So what the section can offer is primarily networking with other specialists like myself and the other board members.
Keep your hand nice and relaxed, sir.
And we can serve as mentors to them with their clinical cases. We can also help them on what we call the road to becoming a certified hand therapist.
It's amazing how many calls I get during the week from people that say, you know, my mother fell and broke her wrist. She lives in Florida. Do you know any PT hand therapists down in that area? And we're very much connected. There's great leadership opportunities, and I truly believe that our section has what you need to allow a physical therapist to be successful, regardless of how many patients, hand patients they might see, whether it's a few or many.
Maybe just a mild warmth.
I'm very lucky to find the people that I've met through my hand therapy professional life, that they've been able to guide as much as they did, and I'm very thankful that the reason that I got here it has been because of them, because they've given me the opportunities to do it.
Physical therapists probably save a few lives, but in reality what we do is we make the lives worth living, and that's what hand therapists are just really great at.
You see in your patients the change in their life, and they're truly, truly grateful just to be able to put on their own shirt or, you know, fix themselves a meal or even lift their coffee cup. It's an amazing, rewarding area to be in.